And actually, it's the only way for that teenage brain to really connect the consequence with the behavior, encouraging them to stop and pause to think the next time around, this is what happened around this particular thing. If it doesn't make sense or it's not linked logically, they won't remember it. So all they can really recall is, I got in trouble, it feels painful. We don't want them to be acting out of an avoidance of getting in trouble. We want them doing the right thing when nobody's looking. That's an innate ability to really make good decisions for oneself and make choices that serve them.
Are you married or in a committed relationship looking for real advice on having love and enriching your relationship? You are in the right place. Welcome to The Couples Expert with Stuart Fensterheim.
Hello, everyone, and welcome back to the Couples Expert podcast. This is Stuart Fensterheim, the Couples Expert. Today, I'm very excited to introduce to my listeners a really talented clinician. Her name is Laurie Dilorenzo, and I have the absolute joy to say to all of you that this incredibly talented, caring therapist has agreed to come to the Couples Expert podcast to be one of my colleagues and work with me in helping all of you have an incredible relationship. The reason that I asked Laurie to join the practice is not only is she talented, not only is she intelligent, but she's one of the more caring people that I've had the pleasure to meet. And she has worked for a number of years, both as a family therapist, a couples therapist, and is currently the primary therapist at a residential program called Spring Hills Academy. Spring Hills Academy is a place where families who are really struggling with their adolescence reach out, and the child goes there and lives on site, and it's a residential treatment program. And Laurie, as the primary therapist, has worked both with the couple, the family, and the adolescent. And today's topic that I want to spend a great deal of time pulling apart with Laurie has to do with a big problem for most of us, which is dealing with adolescence. Not only dealing with our adolescent child who we love tremendously, but how do we handle an angry adolescent? And that really is the topic, and that is something that impacts both the child, the family, and quite often the couple. And we're going to be asking Laurie to talk a little bit about that. But let me tell you a little bit more about Laurie's background. Laurie comes to us from the Midwest. She has raised her own family and is really dedicating herself to really being someone that specializes in working with also something that's called somatic therapy. And one of the things I want to talk with her about today is that aspect of counseling. She really is bringing to the practice another dimension, because here at the Couples Expert, we are experts at helping couples connect with one another in a very deep, authentic, and vulnerable way. And what we know is if we can also include the family in that, just imagine what our world could be like. To have a family that everyone feels important, everyone feels special, that someone has your back, and never feeling alone in this world. I think our world would be a different place, don't you? So, Laurie, I want to really welcome you to the podcast, and I'm excited to speak with you about your expertise on helping families.
Thank you, Stuart. It's wonderful to be here. I think it's such an important topic that you raise, and I'm excited to talk about that.
That's great. You know, one of the things I like to ask folks when they come on the show, and the first question I always ask people is, tell me a little bit about why you decided to go into this absolute crazy field.
Well, you said that well. Absolutely crazy at times. I spent many years working in the medical field, actually, and having raised my children and spending some time with them, I was that person that the kids would come to, that families would come to. And I recognized that I had a skill set and an innate way of working with people that I really wanted to grow. So I went back for my master's degree in social work and have since really launched my work in focusing on adolescents and families in particular. I have a special interest in that area because it's such an important system that we can impact and really have some profound changes. I was lucky to have two children that really managed their teenage years well, but I also witnessed many who did not, and those challenges were extraordinary. And again, you mentioned with both the family system, the marriage, and for the child themselves, it impacts all systems.
Was there something about your background that sort of led you to being a caring professional?
That's a great question. Yeah, actually, I work right now with some teenage gals that are in a therapeutic boarding school. They were struggling in their lives, and I really resonate with that. I was also that teenager that really, really struggled. Didn't really have the kind of support that would have been helpful at that particular time in my life. What I've recognized in my own experience and in working with adolescents is that they're often very misunderstood. They need a level of support that isn't always innate to parents. And so if we can encourage those systems to be healed and strengthened, we see a much better result for that teenager.
So with that understanding, and it sounds like you do have that, tell me a little bit about when we talk about an angry adolescent, how should we define that? How should we define an angry child that we have, an adolescent that has inappropriate anger? Because I think a lot of the questions that people have, as you know, is that it's just a phase. Is this something that they're going through? Are all kids like that? Then I know there's the other side where anger quite often could be a mask for other things. And how do we know as parents whether our child is someone who needs more help than what we're giving them so far, or do we just let them go through this phase?
Yeah, that's a great question, Stuart, because I think many of us parents understand that teenagers are just inherently moody, both males and females. And what's the distinction between this child that's just experiencing some normal moodiness and anger and one that might be problematic? And the way that I look at it is, what is the impairment on their functioning in terms of, are they still being able to manage relationships at home well enough? We'll have these experiences of moodiness, and certainly there are things we should expect with teenagers in terms of not wanting to necessarily get our advice, not wanting to share everything about their experience, being resistant to being controlled or being asked to do things. Those are normal teenage behaviors. When we're starting to cross over into some more problematic behaviors, we're looking at those challenges that really are resistant, that you'll see them isolating a little bit more. You'll see them hanging out with peers more than at home. They're definitely experiencing some more resistance to any parental direction and the expectations in the home. My experience with families, with teenagers, is really the bigger challenge of holding good boundaries, and have we been able to do that all along?
Laurie, when you say good boundaries, I think that's a really good question, because so often parents are unclear how rigid of a boundary to set, what is an appropriate boundary. What would you say as a family therapist when someone is trying to figure out, rules for the house? What are some of the boundary issues that you feel are the healthy boundaries for kids who may be having some issues?
So the challenge is really trying to hold the family values in front of you as you're trying to determine what should that look like for our family. As I say that, there are some common things that we need to consider. We need to consider that teenagers are individuating right now, trying to figure out who they are. So we really want to give some room for that experience to happen. At the same time, we want to be clear that we are the parents and that we hold that authority. And we do that in a way that actually encourages their own independence, their own growth, their own decision-making, while still being the authority in the home. The kids actually really feel safer knowing that the parents have the strength to hold those boundaries, to really say to them, these are our expectations because we believe you can manage those expectations.
You mean the kids aren't in charge?
The kids are not in charge.
Really? My daughters would have said to me when they were that age that they clearly were in charge, I think. And sometimes it feels that way. It really does, because it feels like you're always having to bend or negotiate things. And they always, and I think the influence of friends and them seeing other families. So when we talk about family values, one of the questions is whose value? And I know you're probably going to say, your value, but that's a really difficult struggle, because sometimes the values for some of us and for the families that I've seen, a lot of them have not been raised in maybe a healthy environment. So they don't have a really good model for that. Right. So how do you determine that?
Well, and that might be where you need some assistance to really get clear. What is it that I want in my life? What is it that I want in my family system? If that hasn't been modeled for you, I always encourage that somebody get some assistance around that and really help make that clear. When you're able to do that and you have this common goal for the whole family system, then you're working with a map. You're working with something, and the kids are always included in that. So when you have teenagers and you're working with teenagers, it's really important that that flexibility is in there. You want to choose your battles, right? There are the big, hard and fast things that we have to adhere to, and it's understood in the family system. These are our family values. These are non-negotiable. Everything else we can talk about. And if that child presents to us in a way that is responsible and can take accountability around their actions, then they're wonderful to negotiate with. When we're talking about angry kids, it's much more important that we're the ones that hold these firm lines. We don't want to engage angry teenagers with more anger. That's the biggest mistake that people make. We need to check in with ourselves, really notice our own emotions as we start to go into that battle, if you will.
I'm glad you said that, because as I mentioned in my introduction, one of your expertise is working with somatic kinds of things, the body and the signals and the messages that we get from our bodies. When we talk about anger, both in helping our child, but more importantly with what you just raised, helping ourselves not respond to the anger in anger, because then we just escalate everything. Do you have any suggestions for those of us that sometimes find ourselves really recognizing that we're getting as angry as the child, if not more? How do we calm ourselves down? Could you explain more completely, perhaps, when we talk about somatic types of interventions with counseling,
Sure.
What that really is?
Sure. So first, let me go back to your original question. How do we guide parents in what's best for them as they start to enter into these discussions with their teenagers? And as we know, when kids aren't getting what they want, they can escalate that. And if we match that, we need to put our boots on. We need to strap in for the battle. That's not what we want to do. We want to be able to engage these kids in a way that encourages healthy communication, healthy problem solving within themselves. So I ask parents to use this kind of visualization. It's really around mindfulness, really checking into self. And so
define mindfulness for folks.
Yeah, mindfulness means that we are really present in our moment. We are present, we are attending to what is right in front of us, this conversation, as opposed to bringing in information from yesterday or the stressors that we're anticipating, really staying right here, present right now.
So not dealing with your child who may have acted out last week or yesterday.
Yes.
Putting that, almost having a little bit of amnesia.
Yes, and it's very important for all of us, right? I mean, How can we manage if it's a scorecard being brought to the table? We really want to deal with each issue in the moment, separate from any other experience. So as I say that, I ask kids to do this as well as their parents, to envision the red light, yellow light, green light. This is mindful communication. And what that means is when we check into ourselves as we're starting to enter into that discussion, we want to know, am I really open for this discussion? If I'm open and engaged and available, then I consider myself to be in green light. And then if I'm not, if I'm really closed off, if there are stressors or if there are things that are in my experience right now that do not allow me to fully engage in that conversation in the way that is going to be productive and helpful, then we know we're in red light. When somebody's in red light, I will say to them, you need to take some time away and really check into yourself and ask yourself, what will it take for me to get into green light? And that might mean that I can't have this conversation in the next 30 minutes.
The answer, though, for some adolescents may be for my parents to leave me alone.
Yeah.
Just for me to be off by myself, follow my own rules. You guys have your life, I have my life. How do you handle that kind of problem with the red light, yellow, and green?
Yeah. So when we're teaching people to really get into a mindful space, and I want to back up just a little bit because the yellow light's important, and I don't want to miss that opportunity to say that. Yellow light is when we're saying to ourselves, I'm really not sure. Am I open or am I not? And that's taking that pause to really check in. And just like most of us that drive, you see the yellow light and we make a decision. We can either step on the gas and really plow through it.
Right.
Which would actually almost always put us into a red light kind of experience when we're entering into communication, when we plow through and don't check in. That would be an opportunity for those of us that slow down at the yellow light to really understand that slowing down is the most important part of entering into those communications. When we slow down, we can really check into self. So to answer your other question, as you're talking about teenagers that present and say, I just want my own life, I want autonomy, I want to be able to do things my way. That's developmentally important. We want to honor that as long as they can do that responsibly. And the goal is that we want to teach them in their communication that we can have these conversations, and if you can handle things responsibly, we want to expand those opportunities for you. What is really fascinating to me, and I think parents really misunderstand this, they believe that by being a friend to their child, that they are actually encouraging that relationship. That is absolutely false. I hear it every single time from kids. They feel very, very unsafe if their parent is meeting them, essentially in their minds, where they are. They need guidance. They need to know that somebody's navigated this world with confidence and be able to rely on them as a resource. The more we convey that confidence and those boundaries with our kids consistently, right? Consistency is the most important part because when we waver, when we're wishy-washy, it conveys that you are not a confident parent. And that creates fear for that child. So when they're saying, I want all these things, there is a part of them that is actually absolutely accurate about that. But there's another part that most parents don't identify with, they don't recognize, and that is kids actually really, really, really want discipline. They really want structure.
Right. And I think we maybe want to define this not as much as discipline and more as structure. Because I think discipline has that negative connotation of... It
does.
And I think what you're really saying that I like a lot is that a child and a parent connecting is less about being sort of on the same page and more about people having a clear sense of whose role is what, that as mom or as dad, you make the rules, and as the child or adolescent, I have to follow the rules, and that when I have my own family, I can make my own rules. But living here is no different than being on the job, where sometimes you have to follow rules that you think are nuts.
Yeah. It's a perfect training ground, right, for our adult life.
And I think the other piece that comes with this, for me, is helping the parent not be such an insecure parent. And I think that's where the wavering comes from, is people make decisions and they're not clear in their own head if it's the right decision.
Absolutely. And in that way, it's really important, I think, to get some guidance around what is it that I want for my family. When you operate from that roadmap, everything else becomes more clear. What I have experienced multiple times is that inability to really feel confident in your decisions, as you just mentioned. And so what ends up happening is they try on all kinds of different things. And as they do that, that's where that inconsistency presents, and that's where that teenager doesn't feel confident in the parent's abilities.
Right, and then feel like I have to make some of my own life choices because my parents not there for me because they don't know what the hell they're doing.
Yeah, at a time that life is actually pretty challenging. There's a lot that they're contending with, and it's pretty scary for them. So really what's underneath a lot of that anger is fear. a tremendous amount of fear. And so when we're able to encourage healthy dialogue between us, really open, healthy dialogue, we're hoping that the kids will come to us and share those fears, share those experiences, look to us as a source of support and wisdom around the things that you and I both experienced and all of us experienced. Stuart, you brought up that topic of discipline kind of having a negative connotation, and I think that there is a misunderstanding about what discipline really is. Discipline, by definition, is really teaching, and that is absolutely our goal with working with children and adolescents. We're teaching, and so it's really, really important that we look at the concept of discipline as one in which we hope to encourage lessons. We hope to encourage learning in the process.
And that's why I think logical consequences make so much sense, because that's what we get in life.
Absolutely. And actually, it's the only way for that teenage brain to really connect the consequence with the behavior, encouraging them to stop and pause to think the next time around. This is what happened around this particular thing. If it doesn't make sense or it's not linked logically, they won't remember it. So all they can really recall is, I got in trouble, it feels painful. We don't want them to be acting out of an avoidance of getting in trouble. We want them doing the right thing when nobody's looking. That's an innate ability to really make good decisions for oneself and make choices that serve them.
So when we, again, staying focused on the angry adolescent, because my hunch is if we have an angry adolescent and the anger is in sort of excess of what you would expect, there's likely going to be some history that things in the family haven't gone so well. And I think that's probably a fair assessment. When you are already there, though, and you have a child that's, whether it's an aggressive child who's breaking things or destroying things or violating some major kind of rules, what's your advice on how to help as a family member, as a family? How do you at that point set clear boundaries and limits?
Well, this is exactly what I work with when I talk about working in residential treatment. These young ladies get there and their anger has really caused them to act out in ways that make it difficult for the family, again, to just manage and know how to handle that. So they come to us, and we're a family systems program. And the reason that we operate like that is because of what you just stated. It is often a symptom of the family itself. So you definitely want to look at the total functioning of the family system to address that more immediate question, what do I do when my kid is really out of control? If you have good communication already on board and that's been established in your family, then it's a really easy transition to say, let's sit down and really communicate some empathy to that kiddo. Not judgment, not being critical, because you'll be met with that. When you sit down with them and say, hey, I'm noticing you're really challenged. There's a real problem here. How can I help? What's going on for you? Really getting into that empathic space where you want to understand that it's more than just what's showing up in the home, that you have an understanding that there is probably an internal process that's going on for them that's challenging, and we want to tease that out. If that's not on board, or if that kiddo is at a point right now where they're really pushing everybody away and avoiding those conversations, then you can't have that step. You jump right to, I love you, our family is important, and for that reason, we need to establish some real boundaries here, some rules and expectations with consequences. I need for us to have that conversation because my goal is to help you. You're not prepared to talk to me right now, but if we can do this, I want you to know that I'm here for you around these things. You have your job in this family, and I have mine. And we really open up that dialogue, setting down these really, really clear expectations. And again, the key is consistency every single time.
So the question that often comes up with these really angry kids is, at what point do I begin to consider out-of-home placements? How would you define that?
what I hear often from families is they were no longer able to contain the kiddo in the home environment. So all teenagers have risk-taking behaviors because of their brain development not being quite there yet. But when they start to get so risky and you can't control them, every measure you've taken really is not encouraging that kid to make a different choice. That's when you need to seek outside help.
So safety obviously is one huge one.
Primary
safety to the child themselves and also safety to other family members. And sometimes that's where it gets tricky too, because you have sibling conflicts and boys fighting with boys sometimes. And sometimes it's just kids being kids. How do you determine that line of when it goes beyond that?
Well, there again, it really does speak to the level of functioning. So if you have a teenager that's in the home that's highly disruptive to your younger children, highly disruptive to the family system, and they're not willing to follow the expectations and the boundaries that are set, they're not able to make any movement around that. You certainly want to give that some time. It's not going to happen overnight. You want to give that a little bit of time and a little bit of coaching. But if you're noticing that those behaviors are actually damaging to the family system in general, that's when I would first encourage therapy, right? Have you tried therapy first? Are we trying to understand what's at the root of this anger? Because teenagers, while they may be moody, that is certainly not a normal behavior for a kid to have that degree of dysfunction and impairment in the home or any other setting for that matter. So first, we're trying therapy. I'm sure that all of you have experienced teenagers that are not very enthusiastic about attending therapy. And I'm pretty open about what that means. So when I have worked with teenagers in an outpatient setting and they're not open, they're very resistant to therapy, I will very openly say, you know, as we look at the choices that we have in front of us, we're here to really help you in the easiest way possible. And this is the best way I know. If we can't help you, then we have to look at other options. And those other options can be kind of disruptive to your experience right now. And they get curious. You know, of course, they're going to get very resistant around that and say, oh, well, I don't need that. Or you can't do that. And so really emphasizing to them that it isn't about power and control as being the parent or even the therapist who's involved in joining the family, but it's about putting down some real firm boundaries to say, I have to do whatever it takes to make sure that you're safe, that you are functioning at a level that allows you to move forward in your life, that the rest of our family is not impacted by these behaviors. That's my job.
And what's interesting for me is some of the hypocrisy that comes along with that for families, because I hear parents saying to the child, you know, you have to get to counseling because you're out of control and you're creating all this chaos in the family. And then when the child says, I'm not going, the family say, well, I guess there's nothing we can do. Well, that's pretty hypocritical because they just said the family's out of control. And I think quite often the intervention in the beginning, at least sometimes, has to be the parents coming in. If you as a parent say, we have to go to counseling, child says no, and then you don't go to counseling, why did you even bring it up?
Yeah.
You know, it's really an interesting dilemma.
It is.
I think that's when families have to get in there without the child, because a lot of the times, if we look at sort of the two of you as a couple, and not only as parents, but clearly for most people, this impacts their relationship as a couple so much that you need to get in there and find a method that's going to work for the two of you, because it's got to be the two of you working together.
Absolutely. So one of the leading causes of divorce, as we know, is parenting issues and the disruption. Oftentimes we're not on the same page, and that's communicated in the family system. It's very confusing to children. And
that sometimes is the anger.
That's sometimes the anger, absolutely.
Of the kids I'm talking about.
The benefit of working first with the parents is to really get an understanding, how does this family system function? What are the conflicts between the parents in terms of raising kids? Teenagers are incredibly adept at splitting parents if there's an opportunity. And so that really can disrupt the marriage as well. what we want to do is really get into that conversation about what is it that we can agree on? What do we need help in negotiating on? But a united front is super important. I couldn't consider, quite honestly, working with a teenager in isolation. It's rarely a function of just the teenager. It is always, in my opinion, I have not had an experience where this hasn't been true, that there is a need for an improvement in the family system altogether. One of the wonderful things that happens when families, first the parents, say, I'm going to go to therapy and understand what's happening in our system, is that it conveys to the child that I'm as interested in fixing this problem, and I'm not blaming you entirely.
The blame goes away if you say, we're all going in.
We all love each other. We all have a common goal for us to really make this the best it can be. And if there is a part, and this is what the parents are conveying by going, if there is a part that I'm playing, and there always is, then I'm going to work on that too. And it really models healthy functioning and seeking assistance around trying to be the best version of ourselves.
Well, Laurie, I want to really thank you both for now being a member of our team, but also for really sharing your expertise on some of this. And before we end, I want to ask one last question, which really is about a clearer understanding what the somatic counseling is, because it's something that you really have a specialty in. Could you talk a little bit about that, and also let my listeners know that if they want to reach you, how to get hold of you?
Sure. So, yeah, the somatic experiencing is work that is looking at treating the nervous system. What we want to do is teach the child, or anybody for that matter, how to be able to convey what their experience is without all these big emotions, without this big activation in our nervous system. And what that looks like is you'll notice that your heart's racing, you're starting to get really anxious, you're starting to feel shut down, even anger will come up. So as we learn to communicate and keep that nervous system really tamed, then we're able to really keep our cognitions on board. Because when our emotions take over, we start to lose our ability to really stay present, to really stay focused on what the topic is. So it's one way of working with people, what we call a bottom-up approach. The other way is through EMDR. And that's another ability to process some of our experiences that allow us to share those experiences without this big emotional, energetic charge, if you will. So most of us, we can look back on an experience and recall exactly what that felt like to be in that moment. And so when we have those particular memories where we can really feel like we were back in that moment, and you can feel that activation in your system, that is a problematic memory, and it actually impacts our functioning in ways that we're not always aware of. So when we're able to rid ourselves, if you will, because we can mitigate this through these modalities, if we're able to do that, then once again, we're not bringing the past into our present as we're trying to deal with our current issues.
Yeah, one of the things I did forget to mention, that Laurie is a specialist that does do EMDR. And one of the things I'm going to do, Laurie, is have you back on the podcast in the fall. And what we're going to do is really talk about EMDR, because EMDR is really an exciting method that we now will have here at the practice, where people can really get unstuck from a lot of their past experiences. And I think conflicts with kids sometimes could be that kind of
bringing up
place.
our old experiences are present, and we're not always aware how much it's actually driving the relationship and what we're presenting in the relationship. I'm excited about that particular podcast. I have a strong interest, and I do a lot of work in developmental trauma, relational trauma, as well as the trauma that most of us identify with, the bigger traumas. It's a fascinating field to be in right now, in the ways in which we can heal these things, as opposed to just working our way through them. We can actually heal them.
Which means that we can then live with those experiences in a way that they don't immediately impact our life.
Absolutely.
And that is exciting.
It is.
Thank you, Laurie, again for being here. Thank you, all of you, for tuning in again this week. And, last question. If someone wants to get hold of you, Laurie, how could they do that?
So you can reach me directly at the Couples Experts direct line, and you can also book online.
It's www.thecouplesexperts.com. I think most of you may know that. And you could also reach Laurie through the practice at 480-993-1922. And thank you again, Laurie, for joining us. As always, stay connected. Bye-bye.